people, and I gave an opinion on the Medical Council of India. I told that MBBS degree should be obsolete. You abolish the MBBS degree, and we can reduce the course from 9 years, MBBS 5-6 years, housemanship, internship, then post-graduation, almost about 9-10 years if it gets to the one chance. You reduce it 3 years basic courses. After 3 years basic courses, everybody should give an entrance, and there you open up specialization and super specialization for again 3 years. After 6 years, one is from the exit, one will be found in one of the specialty, and everybody will be happy on that aspect. Increase the seats. There are a number of newer branches which can be developed for that. But the same MBBS syllabus is being continued till date. Importance of bedside medicine, problem-based learning, skill development training. There is a need for that. Focus on attitude and aptitude, dearth of mentors, mediocrity versus excellence, and continuing professional development course. These are all necessity for that. And what we have not read in medical schools, apart from these medical studies, the art of communication, the art of human behavior, the art of really the stress management, the time management, the finance management. I think that should be a part of the curriculum in the MBBS career in the medical courses. Then they enter into medical practice. Somebody goes for general practitioner, specialist, super specialist, from India to abroad, from rural to urban, from private to government, from practice to teaching, from medical profession to other profession also. They become ministers after leaving this profession also. And majority settles and continue, but very few are dissatisfied till last. Pleasures and pains are there, benefits and risks are there. You need a happiness for that. With that, you have to find out what I have done for the last so many years. I have read it, and what is my next aim of future. Last phase of life. There is no on stage, end stage. This is a unique profession where there is no end stage unless incapacitated. You can change your profession, but continue activities. I always say, the mentor, one of my emeritus professor, Professor M.N. Parikh told, at the age of 85 attends all conference. I asked, what is your... He told that till the last breath, I will maintain, I will be active. And till the last breath, I will be active in my profession as well as non-professional social activities. But the second important aspect is, I will be in touch with the youngsters about 20 to 30 and take beer with them or their drinks with them rather than with the old people, so that to keep myself fit for that. But the many people are saying that even if you change your profession, don't stop at that particular level. Till your last breath you continue your activities, then only you can have a very healthy life and end of life. Time for enjoyment of life, sharing experiences, social activity, religious issues, physical and psychological disabilities also can be a part of that. But in spite of all these, you change your characteristics. But that also, your physical activities will grow. Use or lose, that is the synonymous, that is the universal truth. If you do not use, you lose it. And therefore, physical also, if you sit, the physical will iterate, psychological will be tremendous impact will be there. And what is preferable in the last? Whether you want a Parkinsonism or Alzheimer's, what is your option? These are the two options. Either you suffer from Parkinsonism or you Alzheimer's. Which option you wanted? I think it's Parkinsonism. Why? It is better to spill half glass of beer than forgetting where you had kept the bottle there. And therefore this is an option which has to be adopted further. Highest percentage of specialized doctors, more is the disease. More laws in the court, less is the justice. But this is the thing which our profession always emphasizes. There is no other profession which asks these questions. Who, why, where, what, when and how. And this is R. Kipling's theory, where everything if you maintain, you really achieve a lot in that and really be successful in that. And we are, doctor as a healer, we work in a world of living and a world of dead. It's the unbreakable bridge of human love. Apart from the science we apply, if you just think and close your eyes and just think of the other side, the work and the breeze of the love and philosophy is there incorporated. Disease-based medical education versus patient-based medical education, there should be a change in that. And this is a very important thing. If you listen to your patient long enough, he or she should tell you what is wrong with him or her. And we have entered into an era of scanner, era of scopy. I think we forget the art of listening, art of communication, the history, the classical examination. We are not applying this, and that's really a pity in this situation. The ear says more than tongue, but the tongue has no bones, but it has a capacity to break bones. Don't allow your tongue to say. You better keep quiet and listen more than talking. If you talk, you spell out new things which is adverse to you also. If there is no problem, there is no joy. People say that society, there is a lot of problem, crisis nowadays. I think the changed definition of the society and the changed definition of happiness is living dangerously. The new definition of happiness is living dangerously is the new definition of happiness in the 21st century. Wise people learn from their own mistake and wiser people learn from mistakes of others. We always say in a medical profession, we have done a mistake, we'll correct in the next case. Don't do that. If you do the mistakes and correct it, whole life will be spending in doing mistakes and correcting also. You better gain from your mistake and gain from other mistake, gain from your mistake and learn from other mistake. That's a very important switch, so that in your lifespan you can develop and you can gain many things. Young doctors, they believe that there is a pill for every ill. Absolutely wrong. Surgical correction for any anatomical deviation, I have 200% wrong. Scopes and scanners, be all and end all. I think they must abstain from these theories and rely on some conventional and our own brain, own mind and own thinking. Try to be a man of value rather than a man of success. A man of value is more important, but love all. But don't trust all. If they trust a few, I'm giving hints to the medical director, love all in your hospital, but trust a few. Do wrong to none. I think this should be a philosophy of a head if he's a medical director. Read little. Nowadays, I have told recently, I was just inspiring our new entrants, MBBS students and postgraduates, a freshers day. Welcoming them, I remember my old days. My teachers were telling, this is a profession, this is a branch which we read and read. If you do not work hard and read, you are not going to pass. Now the reverse I am advising to my students. Read less, think more. Don't read more. If you read for 15 minutes, think for half an hour. That will elaborate and that will be a conceptual amalgamation of knowledge rather than a mechanical inception of that. See much and do much. There's a change here. In treatment abuse, this is my feeling. After 33 to 35 years of my as a professional as a gynecologist, I say that treatment abuse, it takes 5 years to learn and do this surgery, but it takes 25 years to decide not to do this surgery. That should be the philosophy, and this is the experience which gains and we apply that. Malignant myths, these are all malignant medical myths, screening industry, artificial epidemics, high-tech interventions, healthcare versus healthcare, technology-driven research, pharma-driven treatment. I think these are all modern medical delusions which you think and analyze. Though they are helpful to us, I don't say that you discard them. These are really supplementary gadgets. You help your brain. This cannot replace your thinking. This cannot replace your brain. There are 3 lies in medicine. One is a lie, second is a medical statistics, third is a cause of table death. These are all 3 lies in medicine. And there are 3 blunders in life. This is an anonymous statement, anonymous doctor has given me this. And 3 blunders in life to become a doctor. First. Second, to select doctor as a life partner. Third, to create doctors as a progeny. I think I am also in the same line. I have done all these 3 blunders in my life. And is by choice or by chance, I do not know. And some of you and many of you must have this ambition for that. These are again an anonymous statement. Advances in medicine. In 2000 BC, it was told that here eat the root. In 1000 AD, that root is hidden, say this prayer. In 1850 AD, that prayer is superstitious, here drink this potion. 1940 AD, that potion is snake oil, here swallow this pill. 1985, that pill is ineffective, here take this antibiotic. 2000 AD, that antibiotic is dangerous, here eat this root. Again, we have done the full circle for that and coming to the full circle. Now coming to the modern medicines where we have reached, after long years of dedicated research, I will just highlight what are those implicit evidences for that. Modern medicines, accepted by university, European university, is a science only in 12th century. Until then it was considered to be sorcery, witchcraft, mumbo jumbo and magic. Modern medicine, for all its breathtaking advances, seems to be slightly off balance like a tower of Pisa. It's not straight and everybody knows and everybody cannot explain that also. Medicine is first and foremost an art based on scientific principles. It's not a true science, remember. Only chemistry is a true science. Physics is also not a true science. Where there is a hypothesis, it's not science. Where there is a concrete proof, it is science. And chemistry is the only subject which deals with science. Medical science is never a true science. 2 plus 2 is never equal to 4 in all subjects in medicines. Rather, it's an application of existing scientific knowledge for the benefit of suffering humanity. And again, medicine, some people say that it cure rarely, comfort mostly, but console always. Regarding the research we have advances, what are the pitfalls of research? We'll find out. half of what man knows today would be proved wrong in 5 years' time. But the problem with mankind is that they do not know which half it is. 35,000 research papers per month are published in biomedical journals, out of which less than 1% of it is making any mark in advancing human wisdom. 99% of creating confusion among practitioners, replicating what the advanced West does to publish or perish. And the problem of research is that the people who work do not publish, those who publish do not work. If the people who work do publish, I think that science will grow and all that. And time is there to change the philosophy. Those who work do their public. But those who work do not have a time to publish. And those who publish, I think with the 15 minutes in an air-conditioned room with the internet, they can publish 50 papers out of that also. And this is a problem of research, a global scenario. I'm giving a small example. Nobel Prize was given to J.J. Thomson in the year 1907, showing that electrons were particles. Just electrons were particles. In 1937, 30 years after that, his worthy son, J.J. Thomson, his worthy son, received again Nobel, showing that electrons were waves. The father tells that electrons were particles. The son tells that electrons were waves. But both of them were Nobel laureate. Which is true, we do not know. But the only truth we know that father and son were Nobel laureate. Human body, something special. Doctrine of probability doesn't always work. Laws of deterministic predictability doesn't apply. Predicting the unpredictable is a dangerous consequence. The only certainty that works in the human body is uncertainty. What is a normal man? We control group and study group. What is a normal man? Defining normal human being is another imprecise exercise in present-day medicine. Statistical definition of normal is meant plus minus 2 standard deviation in Gaussian distribution. 5% of normal population will be abnormal, so-called false positives. Results of Hitech total body scanner. 100 people were taken, apparently normal individuals, are subjected to Hitech scanner, and about 2,500 structural and functional abnormalities were detected in them. So who tells that is normal and how to control, study with the control is difficult to predict for them. Evidence-based medicine again has become confusion. Evidence-based medicine versus evidence-burdened medicine. More controversies rather than consensus. Abundance of exponential increase in literature. Statistical science prevailing medical science. Focusing on reductionistic science. Shifting away from holistic science. Drug studies, authenticity, research frauds. Emergence of pseudo-academics and confusion. In any of the drug series, the results are already known. Then we start the studies. That is the usual situation where the pharmaceutical impact is there. Easy access to internet but difficult in synthesis. Problems in the evidence of evidence, problem of well-managed control, dynamic human body versus linear mathematical model, organ-oriented rather than body and mind-oriented approach, research methodology, there is a lot of lacunae and pitfalls. Discrepancy between in vivo and in vitro studies, animal model contemplating human structure, de-emphasizing individual clinical experience, observation and intuition. So each medical science learning facts from books and journals only and not thinking for yourself. Time is there. Introspection should be there. Any doctor who thinks a little can do a really remarkable job apart from the gaining of the knowledge. It's an amalgamation of scientific knowledge, critical analysis and true introspection with a real human touch. And that message I will give you, that the real introspection is necessary so that you can do really a good job. Lastly, a few slides. Doctrine and art. Human touch we know, head and heart and hand we know, moral issues, legal issues, somebody should be there in the courses, interpersonal relationship, interprofessional relationship, and we should be a manager as well as a leader in true sense. And this art of doctrine should be developed along with whatever studies we know. Communication skill, counseling, family life and professional life alliance, social issues, social movements, stress management, finance management, discovering non-professional talents within. Everybody feels that doctors are more stressful. I always say, without stress, no growth. Stress should be there. But stress is divided into two aspects, positive stress and negative stress. Positive stress is really a challenge, but negative stress is a threat. You avoid negative stress, but positive stress is really required for the growth. Hard work, control over biology. Every doctor should have a control over biological function, and more so particularly obstetricians. Living for others, not living for yourselves. Control over ego and anger. I think ego and anger you sacrifice. I always tell in all hospitals, when I go to the hospital I say, kindly leave your shoes here. I add one point. Kindly leave your egos and shoes here. That's what the more important period. Than simply telling that kindly leave your shoes here. And behavior, attitude and aptitude, tolerance, these are all required for that. Science, I have already told about the knowledge, about the medical consultation, different acquiring techniques. learning lessons from mistakes, medical introspection. I think time is there for your introspection. And again, be cautious about unnecessary medications, unnecessary investigations, unindicated surgery. You develop a clinical acumen, scopian scanning status. These are all adjuncts, but it cannot replace the high-tech gadgets. Treatment as per the need of the patient, not mood of physician or surgeon. Now this is again a point which I am marking. If you have a laparoscope, if you have a laparoscopy time, it is the mood of the surgeon who is familiar with laparoscope to put the scope, even if it is not indicated. It is the need of the patient rather than the mood. That is very important. And medical education, revamping should be there. Of course, continuing professional development. CME has been changed to this term. Continued medical education has been changed to continued professional development. There is a lot of change in that and a concept change in that. Commerce, industry-driven practice, high-tech gadget-driven intervention, practice versus malpractice, health industry versus health service, health care versus health care, life expectancy versus health expectancy. We always boast of ourselves that we have increased the life expectancy from 33 years, 50 years back to about 66 years in India and 85 years in Japan. I think wrong. Now time has to be thought, and you have to think that health expectancy along with the life expectancy. Till the last breath, how the quality of health should be maintained for that. That's more important. And illness versus wellness concept. We are not targeted for illness only. We are concerned for the wellness concept also. So change in a medical profession, a closed loop, from healthcare to medical care, from disease to diagnosis, from social identity to disease identity, from generalist to specialist and super specialist, from healing to treating, from clinical sense to technological dependence, from rational use to irrational abuse, from faith to court, from pleasure to pain, and from charity to business. And therefore, it needs a serious introspection from we concept to I concept. Forget about I concept. Now time has come to see we concept, and then only we can grow in combined with. Lastly, I must tell 10 reasons why I chose to become a doctor. These are all important reasons why you have entered into this profession. And all of you must agree with me